Welcome to the Dental Forecast. Join Dr. Craig Packer, Dr. Joe Field, and their incredible guests as they expand on the Gen 4 commitment to usher in the next generation of dentistry. Stay with us as we delve into cutting-edge techniques and discussions shaping the future of dental care, right here on the Dental Forecast.
Hey everybody, welcome to the Gen 4 Dental Podcast. Excited to have you join us today. And this is a really fun episode. So we're going to dive into the future, which is now, and that is AI technology in dentistry, and specifically how we're using it in our diagnostic procedures, everything that we do every day when we see our patients, and helping improve our diagnostic outcomes and giving us more predictability and also the ability to help educate patients at a higher level. So really excited to dive in with that. I'll let my partner in crime here, Dr. Craig Packer, introduce our guest for today.
Thank you, Dr. Field. Good to be with you again. Thank you. And I'm super excited to introduce our guest, Sabrina from VideaHealth. We have been eagerly anticipating this opportunity to talk with Sabrina. We've been looking for some amazing content for a new reboot of the Dental Forecast with Joe as a co-host and not just as a frequent guest like we had last year. And Sabrina, in just a second, we'll have you talk a little bit more about yourself. But I wanted to mention that Sabrina brings over 16 years of comprehensive experience within the dental industry, having gained expertise across all facets of the dental business, and is a practicing hygienist, clinically practicing hygienist, and also has been with Videa now for a while. She'll explain kind of that part of it a little bit. She holds a master's degree in healthcare administration, which is amazing, and is deeply passionate about advancing patient care delivery and access through the integration of innovative healthcare technologies. So there's so much more we could say there, but Sabrina, go ahead. Welcome to our podcast. How are you today?
I'm great. Thank you guys so much for inviting me and having me on. I'm excited to chat about one of my passions of dental AI. So I've been in the dental industry about 16 years at this point. 10 of those years as a practicing clinical hygienist. I am still practicing today about once a month just to keep my skill set, but also I selfishly get to use Videa AI in daily practice when I work with my patients. So helps me stay relevant, helps me bring feedback back into VideaHealth and the product, which is great. I am currently a standing manager of customer success for VideaHealth. So essentially what I am in charge of is I have a team that we make sure that teams like Gen 4 are successful with implementing dental AI into their daily workflows and understanding the positive impact that it has on patients and providers and ensuring clinical consistency from a diagnostic perspective. So thanks for having me.
So Sabrina, can you dive, because, there's different options when we're talking AI in dentistry, right? So talk to us, why Videa? Why has this been the place that you've kind of hitched your wagon to and have been so impressed by?
Videa moves very fast in the sense we know where the market should go and want it to go as it relates to dental AI. And so we're constantly innovating, finding areas of expertise and inventing new products that will fully operationalize the dental workflow from beginning for our Huddle product to the end in clinical AI and diagnostic imaging. Also, our culture, the people that we bring onto our team, and being able to integrate into organizations like yours and work alongside in a full round partnership is something that's very, very important to me and my career and who I am as a person. So VideaHealth stands out in many ways in that form.
Awesome.
That sounds great. I mean, so Sabrina, your resume is impressive. Obviously, all the schooling to become a hygienist, which is not easy to do, the prerequisites and the coursework, licensure and all that, and a master's degree. Did you do those concurrently, or how did you end up deciding to do that?
Yeah, so I initially started out as an assistant. I thought I wanted to be a dentist and completely changed my course. It was like, I don't know, maybe I want to be a full-time mom one day. And back when I got into dentistry, that was a thing, right? Like, whereas dentists had to be full-time business owners. So I didn't know that I wanted to be both. It was about year 5 in my career where DSOs started popping up, right? And that's where I ended up pivoting. But I did my bachelor's in 3 years instead of 4. I was eager to get out into the field. And coming out of that, 5 years in private practice, I constantly was looking for growth. What's the next best thing? Building out perio protocols in private practices that didn't really matter much in the grand scheme of things. And so started working for a emerging dental service organization out in New Jersey, where I'm based from. And they had 3 practices at the time. And I noticed a lot of gaps in just, clinical consistency, things that I wanted to drive and improve standards of care around the hygiene department. We had a hygiene director at the time, but, it was beginning, and just looped it under her arm as a mentor. And she is still a great, great dear friend of mine. And she helped me move into a role of director of hygiene. We helped grow from 3 to 10 as she moved into VP of team talent and development. After that, we merged with a much larger DSO, and I had a really unique passion for dental AI. It was introduced into that organization, and I saw what it was doing for the industry. I saw what it did for the patient experience. It was eye-opening to see patients' eyes lighting up as I was showing them things on their x-rays that I couldn't draw good enough before. That was something I was so used to doing with my patients. And then watching and teaching others do the same and embedding it directly into their workflow just became a passion of mine. So I started seeking out dental companies, AI companies, startups, and talking with some of the leadership at VideaHealth, just filling in gaps for them in their early stages, and then ended up at Videa.
Okay. So, and the master's program was something that you got along that way as you started to realize you wanted to be more on the admin side of dentistry.
Yeah, I would say when I decided that I knew I wanted more out of my career as a hygienist, moved into a clinical trainer, I went back for my master's. I went to Phoenix University and did it online in 2 years, and came out with a master's in healthcare administration, and then put it into action as I was promoted into director of hygiene.
Wow.
And so you mentioned that Videa moves fast. So talk to us a little about what's happening now. So a lot of us know where we've been over the last, couple of years. What's happening now in AI?
Right now in AI, I think one of the biggest things that we are looking into and developing products around is revenue cycle management. It's one of the biggest things I feel like that organizations need help with in optimizing time that undergoes these claim submissions, denials, and preventing that from happening and making sure that the bottom line is fulfilled. That's
something I'll raise my hand for. We would love some help with that. That's one of the trickier things that we have found at Rock Hotel Dental as part of one of the Gen 4 offices is that RCM process is just very onerous. If we can find a way to automate that in some way, that would be huge for us.
Yeah. And so being integrated with the practice management software, as well as having the clinical AI insights, that allows us to house all that data and basically package it up in a perfect claim submission where we are making sure that we are on the provider side. We are very provider focused. We want to do what's best for you guys as dentists. And in doing so, we are making sure that we are identifying things that are flagged that insurance companies are looking for to not pay a claim and get around those.
So are you seeing any metrics in that to this point? Like, what kind of impact or results are you seeing there?
Yeah, so this is a net new product. We're currently in beta with only a couple practices. And so we're constantly right now focused on innovating and improving the actual accuracy of all the algorithms and the outputs before we release GA. But it's really, really been exciting to see the actual driver of the outputs of the actual narratives that are coming to play, the images that it's attaching alongside those narratives, which has been really great.
That is amazing. So it can pull the notes, it can pull the images. If you had an intraoral photo, it could attach that. And then it's looking for certain words, I'm assuming, like crack and 55% of occlusal surface being affected, and all those different types of things, where the decay is, creates a claim. And then does that get reviewed by somebody before the claim is sent out? Or can we even just have that part of it happen too? I mean, ultimately, when you have this developed fully.
Yeah, it should be from start to finish. You'd want to review it, right? Really quick once over, make sure that everything's in line, and then send it on out.
Wow. That's amazing. That's going to be a huge time saver.
Yeah, we're really, really excited for its launch.
And so will that tie into, right now, all the Gen 4 offices have the other product. As they're listening to this episode, and other doctors who might not be part of our company right now are listening to this product, they might know about Videa a little bit more on the diagnostic tools side, right? Where it scours your radiographs and it prompts you to look at certain things like bone loss or calculus or caries, voids or imperfect margins, some of the things that it will point out to us. Is that going to be a separate product or a bundled product, or how is that going to work with what we currently are using?
We are hoping by the end, we are going to be by the end of the year at what we call a platform, where we have multiple products in one. Huddle is our main operational product, where when we are integrated with the PMS or the practice management software, we're pulling in operational identifying tasks that maybe need to be completed. We're driving up AI opportunities that have been seen by our AI analysis, where then maybe an opportunity for the doctor to take a closer look at those areas, as well as anything unscheduled in the treatment plan. So that's Huddle, which is an amazing current product that Gen 4 has access to. And then also clinical AI, which is our clinical AI image viewer, where, again, you mentioned we're able to analyze x-rays and surface up potential caries, radiographic bone level assessment, calculus detections, RCM, so revenue cycle management will be another. And then we also have our Insights product as well, which is accessible by your teams. And Insights allows us to uncover treatment that may have been missed and identifying areas where we want to increase case acceptance in some instances or practices. So it's a four level product.
Okay.
With the detection software, we'll talk about that first. From my understanding, AI is, it has a learning capability, right? And so it can kind of learn with the providers. They're approving and rejecting diagnosis. I'd love for you to comment a little bit on that process. And also, second to that, it seems to me like it's been getting better. And so I'd love to hear kind of what you're seeing behind the scenes with that and what we can expect with it now and then moving forward.
So the confirm reject monitor feature is interesting, and it's a topic that constantly gets brought up, I think, by dentists and feedback calls. Some dentists, they feel like they need to do that for every single finding. It feels like they feel like they have the power that they're training the AI. And the reality of it is AI is not diagnosing for dentists. It can't replace us as providers. That's a simple fact. It's there for secondary set of eyes, making sure that in days where we're running rampant and moving from op to op to op, that we're not missing anything. So with that being said, the confirm reject or monitor feature, I think what's nice about that is it allows us to be able to identify or not reject findings that we don't want to discuss with our patients. So it gives us that customization, whereas if you don't agree with a finding and you are able to do that, you're able to reject that finding from the screen. Now, that in itself is not training the AI. So the AI is not necessarily learning in real time. And the reason why that is because all of our algorithms go under rigorous clearance to be FDA approved. And so you mentioned, Dr. Field, that you've noticed that the detections have gotten better and definitely improved over time. And that's true because our machine learning teams are constantly innovating and identifying or collecting data where we see doctors that are rejecting a certain type of findings, and then innovate our algorithms to provide you with better outcomes. And so we recently just launched a new caries model that reduced false negatives and false positives by 65%, which is huge. So I'm happy that you noticed the improvement there.
That's massive. And so is that coming from the feedback you're getting from doctors using it?
Yeah, so we use that data, of course, to inform our upcoming and new and latest models. But we also have a cycle of dentists on staff at Videa that help us train the algorithms behind the scenes. We're pulling in millions of different types of x-rays from all different imaging softwares, sensor types, so that we have a varying data set, right? Where not all images are the same, not all sensors are the same, right? Not all phosphor plates are the same. Some locations are still using phosphor plates. And so we want to make sure that the accuracy is there behind the AI.
What about when radiographs are not taken where there's overlaps or the angle's too steep or something like that? I've noticed that's where we see a lot of maybe false readings from the AI, and that's not the AI's fault. We need to take a better x-ray in those situations. Is there going to be a way, or in the future, where our hygienists or assistants who are mainly taking the radiographs get prompted that maybe perhaps that one's not diagnostic, retake, or something like that? Is that part of what we're looking for?
That is actually something that we talk about at length at Videa. We think it's important without AI, right, to have diagnostic quality images, but even more so with AI in your back pocket. And so that is something that we've looked into and definitely roadmapped out.
Okay. Yeah. Because I think that what we'll find, at least at my office, because I use the clinical, it's called Clinic AI, or what is that one I use every day?
Yeah, so clinical AI is our image viewer for diagnostic, annotations, and then we refer to Huddle as workflow AI.
Yeah, we use both, but as far as the clinical AI side of it, I go over it with every patient. I actually have been confirming, rejecting, or monitoring while they watch me do it, because I still want them to think that I'm smarter than a computer. So I can this one's real, and I can confirm it, or this one's cervical burnout. I'm going to reject that one for now because I want I want the patient to not think I'm being replaced right away. But they are all wowed by it. I love the patient view. That's probably my favorite view, is the patient view. And even being able to show them calculus on a radiograph, or even cement after you've seated a crown and you're taking a post-operative x-ray. All of these things, I think, have made us, our office, better at diagnosis. And I've been surprised. I feel like it's easier to have case acceptance. Moms watching a teenager's mouth that's full of caries, if you can just show them those colors on the screen, they don't seem to even question the fact that we just told them their child has 12 cavities. Like, it's amazing. They're just like, they start getting on the child for not flossing and eating too much sugar, instead of doubting us as dentists, like we're trying to, make more money or something like that. So I think it's been really, really helpful at our office.
Well, and Sabrina, how do you guys, from your standpoint at Videa, how do you envision the case acceptance piece of this? What's the ideal scenario that you play this out as you're developing the software?
Dr. Packer just described it perfectly. I mean, I come from having to draw on my x-rays, and I talk about this at length when I get the opportunity to still meet with dentists and hygienists, but I used to draw areas of incipient lesions and talk about the importance of fluoride, even areas where we were monitoring things, right? And now in VideaHealth, they show up as yellow, right? And so there's tons of areas of it detecting early stage disease where we can finally, for once in dentistry, shift our focus to prevention and things like Curidon and other remineralization tactics that we can use and talk about with our patients, where they shift their mindset and actually go home and floss, or go home and brush twice a day. So having that patient view is super impactful. We also have our presentation mode, where it allows you to pull up one X-ray alongside an intraoral photos, and pictures are worth 1,000 words, where you have reality on the one side and an intraoral photo, right? And then an X-ray science on the left in color, where a patient can't deny it. It's very clearly outlined in two different ways. And then we also can provide them a printout, and if they want to talk about it with their spouse or their loved one, to go home and highlight the diagnosis at play, whether or not that's a remineralization idea that they need to do better at home care, or use Curidon, or get a filling done, getting crown, whatever that may be.
So we're super nerds with metrics and analytics, right? And so with using Videa, what are you seeing as far as the case acceptance increase using it versus not using it?
It automatically goes up. As far as percentage wise, I mean, I don't have an overarching number that I can give to you as a whole, but I would say about 80% of the time, patients are definitely accepting treatment.
I think that might be something we might help with that eventually down the road. I don't know if most of the companies you work with have the analytics dialed in as much as we're trying to get as Gen 4. You work with Mitch, our Dr. Ellingson, our chief clinical officer, I'm sure a lot, and he is one that loves numbers. And so we probably will be able to come back to you in 6 months and tell you actual percentages of what it's done for our company. I know on a day-to-day basis, it definitely makes a difference, one patient at a time. There are some ethical concerns, I wonder, Sabrina, if we could get into and talk about a little bit about whether or not AI could negatively impact patient care. And I think obviously we know the answer to that, and that you were telling us either before we pushed record or after, I can't remember, that this isn't replacing doctors. It's a prompting for us to look better. But do you ever hear that concern that maybe in the industry that AI could lead to overtreatment or any challenges like that?
Yeah, so I think that there are some dentists that are definitely concerned about that. New dentists maybe that are starting out, and we don't want them to fully lean into the AI, right? Like, we want to make sure that we are having that final say in making those decisions. But what I will say is that we have historically, and with some other DSOs that we work with, have heard that this has actually saved them in litigations with patients who have surfaced concerns about treatment that they've done that they didn't think they needed, where the AI has clearly indicated that those areas did need treatment, and they actually won the lawsuit. So there's two folds to this. I think there's definitely the importance of highlighting that this is not that final say, that you have to, as a dentist, make that decision. And diagnosing radiographs and identifying the radiolucencies, using the ability to toggle the AI on and off quickly, which is helpful because it adjusts your eyes to see what you're seeing versus what the AI is seeing. So I think that it's out there and it's a concern, but the more you lean into it and you learn the workflows, as I just mentioned, of how to really toggle the AI on, review with your eyes, and toggle it off, will definitely help with that.
With kind of in that vein of ethical concerns, I mean, with the AI, are there any concerns with privacy and the information being used in a way that could be exposed to bad characters? I mean, anything like that in the AI world with this?
No, I don't think so. I think you have to look at it the same way as you store all of your patient information in your practice management software. We similarly store all of our data the same way, and it's very much protected in that sense. So no, I don't think there's any concerns around patient data.
Probably no different than just the non-AI versions of our radiographs, in our DPMSs. Unless, of course, Matthew Broderick's movie from like the 1980s, what was that movie called where he there was a computer that almost started a world war. So it became so smart that it started to think for itself. We got to make sure that our computers don't get that smart.
You're just dating yourself there, Craig.
The only Matthew Broderick movie you know was when he was skipping school and driving his dad's Ferris Bueller.
Yeah, Ferris Bueller. I got that one.
Oh, it was called War Games. I think it was called War Games.
Oh, yeah. I think I remember that. Watch it.
Okay. What I will say, though, is we are definitely entering into a world where AI, I think, as a whole, is becoming a standard of care. And even more so in dentistry, for sure, it is becoming that standard of care.
Yeah, I was listening to a podcast about it was after we scheduled this one. It was kind of interesting. It just popped up on my feed about that. And the guest for the American Dental Association podcast said that he feels like it will become such a standard of care that if you don't consult AI before you treat, at least consult, that you could get yourself in trouble legally down the road. And so you think about this product that's going to get better and better and better and smarter, millions and millions of radiographs that it searches through and learns from. It's going to start prompting us to things that are, obviously we do need and want that ultimate ability to go through and to check and diagnose. But before we pushed record, I was telling Sabrina that there have been a couple cases in the last couple of months where it's prompted something small. So luckily I probably would have caught it in 6 months, but something small that it did not really jump out at me when I looked at the radiographs without the AI. And I went in and removed an old sealant, and there was definitely decay into dentin starting that I didn't see. It flagged it for me. And in one case, it was a young lady who was leaving the country for 18 months. And so wouldn't have had dental care for 18 months. But because it prompted me, I was able to remove this old sealant. It didn't even look bad, actually. Taking the sealant out, I thought, oh, what's going on here? But I got in there and there was decay that we were able to fix before she went out of the country.
Well, you bring up an interesting point as I think about it. So you said, you made the comment, there's two comments. One, we want the dentist involved, but to your point, like as time goes on, we're getting so many data points, right? I mean, I don't know, Sabrina, like, is there a time where it's like, I mean, why are the dentists even involved? Like, are we just going to mess it up, right? By getting the human error involved now and subjectivity when the AI might be better than we are. I mean, I don't know. What do you think about that?
I think that we're still going to need your hands.
We're not going to have robots.
We're still drilling. I mean, for now.
I don't know that I would trust.
Robots aren't replacing us yet, but
I don't know that I would trust a robot.
Diagnostically?
I mean, here's the thing, right? Diagnostically, the AI is not licensed dentist. It's just not. It didn't go through dental school. It doesn't have a license. It can't say definitively, like, this is the treatment that I'm going to do for this patient. And then if you throw 10 doctors into a mix, who would treat one tooth in 10 different ways, right?
Well, that's what I'm saying. Like the amount of subjectivity in dentistry, and this will be a whole nother podcast, by the way, Craig, but the amount of subjectivity in dentistry is actually, I mean, just like you said, the joke is we always say you can have a 5 dentists look at the same thing and get 5 different diagnoses, right? And so will this eventually be what unifies diagnosis and be like, hey, this is the diagnosis, doctor, right? I don't know.
I think it could. When I was in dental school in Omaha, this was a long time ago, 25 years ago, there was a Reader's Digest article that came out, and the author went all across the country. He had a lot of dental problems in his mouth. He went all across the country, and I think it was something like 15 or 20 different doctors all gave him a treatment plan, and not one of them agreed with each other. And it became national news. We talked about it in school, and it became national news. And so I love the idea, Joe, that it won't replace the doctor, but it might take those extremes of undertreatment and overtreatment and push that down into a much narrower band, I guess, to where we're going to find that ultimately the patients benefit from what's happening in the industry.
Well, I mean, why not? It makes sense to me, but I mean, I'm in Silicon Valley, so I'm a little crazy like that kind of stuff. I don't know.
You'd be crazy if you lived here too, Joe.
Yeah, that's fair. That's fair.
I was thinking from the perspective of like crowns, for example, right? And how we're able to measure the decayed, missing, and filled percentage specifically for crowns.
Mhm.
It's interesting you brought that up, because what is the correct standard, right? Like, what is that clinical standard for when you as dentists would say this tooth has this percent decayed, missing, and filled percentage, it needs a crown? Would AI become that standard? I think, like you said, I think it could.
Yeah, it could.
Well, and even on that, like, and again, we're just, speaking nonsense now, but what about predictive diseases, right? I mean, how well would AI do, and how much would it be involved? Do you see, Sabrina, 5 years from now with Videa being able to predict future decay and future disease issues, and and then there becomes the question of intervention at what point, right? And you mentioned Curadon and other things. I mean, what are your thoughts on that?
Yeah, I mean, I think it's only moving in that direction, right? The only way is to improve, and I absolutely foresee that. I mean, you could take a caries risk assessment for a patient, right? And identifying their historical treatment, what it looked like, what they've had done, how many times they've had decay, or we're monitoring certain areas of incipient lesions, and then predict what they might need in X amount of years. Sure. Even periodontal, I'm thinking like now my mind's going crazy, like thinking periodontal wise, how many patients are underdiagnosed for periodontal disease? Can we predict how progressive the radiographic bone loss would be with our comparison feature, comparing from 1 year to the next, right?
Yeah.
Or what if it digs in and searches family histories? Because you see the whole family and it shows that mom and dad are 65 years old and have so much amount of bone loss. And then it predicts in a 16-year-old child what your future could potentially be based off of genetics, or I don't know. There's a lot, I think, that could come into play in the future. I'm excited about it.
Well, and Sabrina, we're not going to put you on the spot too much, but what are you guys talking about? I mean, what's in your meetings on the Videa side? Like, what are your next projects coming down the pipe?
VideaHealth in general, like we talk about the next 5 years, right? Videa means to see in German. Our CEO, Florian Helen, is from Germany. And health, so to see health. I think that where dentistry is eventually going is medical dental integration. And that's where I would love to see VideaHealth be headed in the next 5 years.
Yeah, that's amazing. We're pretty siloed, aren't we? Always have been with medical and dentistry. Yeah.
You could imagine a world where it's all tied into their medical health record, and all of this data is being pulled into one source, and you're able to holistically treat patients, right?
Yeah, I mean, when I first got into dentistry, and I would say by year 5, that was one of my passions, is like really identifying medical histories and what they came to play with, and then tying that back into what was in their mouth as far as periodontal disease, their buildup, decay, like all of those things really excited me. And it was always completely segmented. And I always had this idea, if hygienists in Jersey were ever able to open a business, like that would be my model, is hiring a GP, a dentist, all under one roof. And I know that's happening in the nation.
Okay, so let me ask you this, Sabrina. I know we're at time, and we're so grateful for your time. As a hygienist, and as someone who has a master's in healthcare, and also as someone who behind the scenes at Videa can see all kinds of data, because you can see what dentists are doing and maybe not doing. Now that you have an opportunity to speak to a group of dentists, what could we be doing to improve the patient's experience and I guess overall outcomes that we don't really know about? We spend our days in our little corner doing our little thing every single day, but I feel like you have this this top-down overall view that we don't get to see. So now that you have our ear, what would you want to tell us?
I would say is the future is dental AI. And if you are at your practice and you are not currently using it in every single way that the platform has to offer, whether that be to chart prep your day and identifying AI opportunities, or reviewing x-rays the second that your assistants, your hygienists are taking those x-rays, reviewing it with the AI on and off, and then using it then to go in and have those diagnostic conversations with your patients and highlighting under patient view, patient presentation, what is at hand. If you're not currently doing that now, you need to do it. Like, don't wait to start integrating this into your daily workflow. Encourage the rest of your practice to start to lean in. Hygienists, there's so many opportunities in identifying early stage periodontal disease. And it wasn't until I leaned into AI and started using it consistently, even today, I am so confident in diagnosing periodontal disease early. Why? Is because it's very clearly identified in the radiographic bone levels by color. And then as soon as I see bleeding on probing and some pocketing in those second molars, I'm like, you have periodontal disease. We need to treat this, Instilling that confidence in our team is super impactful. And I think the time is now. So that is what I will say. There's so many features at your hands and your fingertips to improve the patient experience and the overall clinical standard of care that you're providing your patients. And again, this is going to help you improve case acceptance. I mean, the proof is in the pudding. So I'm so grateful that you guys had me on here, and thank you so much for the opportunity.
That's awesome, Sabrina. Well, thank you. And obviously we agree 100%. We've been using the software for a while now, and anyone listening, doctors or team members that want to get more utilization of this or want to get more training, I know you guys have some incredible resources to help, and we appreciate you partnering with us and the ability that we have at Gen 4 to use the software and the feedback that you take from us. And it's exciting. It's exciting where we're at now and looking forward to the future. So appreciate your time, and for everybody listening, thank you. And Craig, I'll let you leave us with final thoughts here.
Yeah, thank you. I was just going to agree. I think this is a win for everybody. Nobody loses when you use this tool appropriately. It helps the patients, which ultimately that's what it's all about. It also helps us as dentists as we provide, for our families and our team members. It's a win-win all around. There aren't too many things in life that I think when you implement it in the right way is good for everybody involved. And I think that's what we've seen with this product. And I think AI in general as we watch this market grow. And I can't wait for the RCM piece. I'll beta that one. Send that one to me. I'll beta.
You got it, Dr. Packer.
All right. Well, thank you so much, Sabrina. Thanks, everybody, for joining us on this episode of the Dental Forecast. And we've got more good content coming your way here this next couple of months and throughout the year. Thank you so much. Bye, everyone.